Welcome to CNS Focus interview series. This episode features a special guest who has not only made lifetime contribution on medical oncology but also demonstrates leadership in cancer prevention, palliative care and advancing tobacco control. Professor Dr. Bishnu Dutta Paudel, Professor of Medical Oncology at the National Academy of Medical Sciences, Bir Hospital in Nepal, is also the Program Director of Medical Oncology at National Academy of Medical Sciences and member of Tobacco Tax Fund in Nepal. He was conferred upon the first Palliative Care Award for South Asia region 5 years back. He was in conversation with CNS on the sidelines of first ever South Asia Tobacco Control Leadership Program of Johns Hopkins Bloomberg School of Public Health, organized with the International Union Against TB and Lung Disease or the Union, Action Nepal and Ministry of Health of Government of Nepal. Without any further ado, let's listen to Professor Dr. Bishnu Dutta Paudel.
As the life expectancy of Nepal, along with other developing countries, is increasing, so when the life expectancy increases, the diseases like cancer, heart disease also get increases. That's a natural, because the cancer is the disease of generally older people. That is one factor, which is we call non-modifiable factor, that is beyond our control. But there are other modifiable factors also, like tobacco consumption, alcohol consumption, and change in lifestyle activities. Now people are becoming more sedentary, less physical activities, going into more in the vehicle, walking less. So this activities, feel restricted physical activities also increasing the cancer. And other is our dietary habits. Now we are using more refined food, teen food, and less fruits and less vegetables and more chemical adulterated food. So these and junk food, and these are the reasons that the cancer is increasing. So due to these multiple factors, rising age, which is unmodifiable factors, but some modifiable factors like what we drink, what we eat, how we move with our physical activities, these are the factors. Cancer is increasing. Tobacco itself, tobacco is a major cause for the cancer. If suppose we ban tobacco from the world, then 1/3 of the cancer will disappear. So that's only one factor. If you banish the one factor, so around 33% cancer will disappear from the world. And when you talk about the lung cancer, it goes to the 70-80% is the main cause of the tobacco is the main cause. Likewise, oral cavity cancers and other cancers. So there are multiple cancers where the tobacco is involved. Yeah, so what we are doing is, we are, from the multi-sectorally, try to control the tobacco, like we, with the different people, organizations, NGOs, we are introducing anti-tobacco law also. That is also helping to control the tobacco. And another side, like you must have already heard that, we are increasing the amount of pictures in the tobacco pack from 30, 50, 80, now it's 90% we have gone. And you have heard that we got the Bloomberg award also, $1,100,000 also. So we are passing the tobacco laws also. We are pictorial covering also. We are health education program also, different media is also going, school also going, we are conducting, societies also we are going, and harm of the tobacco we are telling, and side by side we are counseling the patients also, because what happens when a patient comes with the cancer to me and I say you should not smoke, and when I say his wife or his son that you should never smoke, otherwise you will also have the same fate, that is a very powerful. At that time they will listen very well. So we are helping to quit, helping to cessation. So in a multifactorial, we are trying to help control the tobacco program. Still, our activities, especially the enforcement of the law, is not very effective actually. Still people are selling tobacco, near the school, near the hospital. Children are buying, pregnant women are buying. Still, anti-law activities are still going on. So it should be 100% implemented. Anybody, if you smoke in the school area or the hospital area, like 100-meter areas near around the school or hospital or public places, if we find, we have to catch each and every and punish. If you strictly use these rules, then tobacco will go down, definitely.
Professor Paudel, you have been so involved with medical oncology. What inspired or motivated you to step out of cancer hospitals and push for effective tobacco control?
Actually, what happened, the most of the patients, when they come to us, as a doctor, we have to take the history taking. So in a history taking, one important part is to ask is the personal history. So the most of the cancer patients, what I found, they are using tobacco. So that prompted, and there is a literature and data also already proved that tobacco is related to the cancer. And practically also what I'm saying is most of my patients are taking tobacco. So I thought if I get involved in the tobacco control activities and if I can minimize or eradicate the tobacco, then maybe the suffering of the people from cancer can be minimized. The union and Mr. Tara and Mr. Chand, they are very active. In fact, they took it to their mission to happen whatever here, whether to pass the Tobacco Act law or 90% pictorial covers, they have a great role because they were going to the media, they run after the politicians, they were run after the peoples. So they work very hard because without the dedication, people and organizations like that, it would have been never possible. Yes, I expect, let's hope, you, me, and all should work together hard that there will be one day that this world will be without tobacco. Let's work hand by hand together to make this world tobacco free.
We were listening to Professor Dr. Bishnu Dutta Paudel, Professor of Medical Oncology at the National Academy of Medical Sciences, Bir Hospital, Nepal. He's also the Program Director of Medical Oncology at National Academy of Medical Sciences and member of Tobacco Tax Fund in Nepal. For more information, be welcome to visit us at www.citizen-news.org. Thanks for listening and stay tuned.